Good afternoon again, and welcome to United TV for our Bariatric Friday session. My name is Kemal Erkan. Today is October 25th, 2024. Today's episode will have the privilege of speaking with Dr. Isaias Irgau, who's an expert in bariatric surgery, passionate advocate of patient-centered care in the field of weight loss surgery. As more people turn into bariatric surgery for a solution to manage obesity and morbid obesity, we also would like to kind of focus on patient perspective as well as the life expectancy and how these are all related to each other and how bariatric surgery can help. Now I have Dr. Irgau with me, and we are gonna start the session. Dr. Irgau, how are you doing?
I'm doing great, Kamal. It's great to be back on yet another session. I love the setting. It keeps getting better.
Good. That's good to hear. So we are gonna discuss the life expectancy. We covered this a couple other times. The issue that we see, the understanding of what bariatric surgery does and what changes needs to happen, what kind of like everyone needs to do, and people with morbid obesity has to do. And then there's this group of people from both sides, they must do to maintain where they are. And we discuss all the benefits and everything, but I think life expectancy is a different perspective of the bariatric surgery outcome. So what do we have to say?
Absolutely. That is really a key point, right? When we ask, does bariatric surgery make a difference, right? Of course, we've talked many times on how important changes and improvement in quality of life occur after bariatric surgery. Just because the physical weight of the weight itself is a huge burden on the patient's daily life. And with that gone, quality of life improves. But then the other question we have to say is, does that really make any difference in terms of how long a patient is going to live? And intuitively, we knew that difference was there, that bariatric surgery does extend one's life, right? But then we needed studies, we needed the data, and the data has come along. Very, very prestigious peer-reviewed journals have come with article after article showing that in very many studies, it has been conclusively showed that bariatric surgery does indeed extend one's life, right? So you've got the New England Journal of Medicine, you've got the Journal of the American Medical Association, you've got Nature, right? Very, very prestigious journal. All of them have carried really articles showing this very important data that has shown indeed that if you compare people who suffer from morbid obesity and you put side by side those who have bariatric surgery to address morbid obesity and those who have the usual care of diet and exercise, you can see that the patients who've had bariatric surgery actually have a longer lifespan, right? And this is despite the fact that they are undergoing a procedure that is a surgical procedure. And we talk about issues of potential complications, even serious complications of bariatric surgery, but really this result, this extended life expectancy after bariatric surgery is the results of two very important things, right? One is the fact that by removing weight, we are also removing many of the complications of obesity that have been known to be the very important reasons for mortality in our country. I'm talking about heart disease, I'm talking about high blood pressure, I'm talking about stroke, I'm talking about cancer, I'm talking about diabetes, as we will see in a moment. But the flip side of that coin is that we have made bariatric surgery extremely safe as well, right? If you look over the last 30, 40 years, there have been massive improvements in the quality of bariatric surgery and in the outcome. And if you look at a very important measure, which is what we call the 30-day mortality rate of bariatric surgery, we have shown clearly that that has gone down tremendously. So that very major bariatric procedures like gastric bypass, like the sleeve gastrectomy, nowadays actually are as safe as procedures like gallbladder surgery or hysterectomy or knee replacement surgery. So reducing the risks of bariatric surgery And if you link that with the benefits of weight loss in terms of the health of the person, then you can see why we are seeing such important results in terms of the life expectancy. And then, as I said, intuitively, we understand that. I was actually just looking at the leading causes of mortality in our country. If you look, for instance, there is data from 2022. The number one cause of mortality in 2022 was heart disease at 700,000 people dying. The number two cause was cancer at 600,000. The number three was accidents, but then after that, there is COVID. After that, there is stroke, there is chronic lung disease, there's Alzheimer's, and then there is diabetes. Now, if you take out accidents, all the other reasons for major mortality that have been listed here, carrying numbers like 700,000 or 100,000 at the smallest, all these are related to morbid obesity. Even cancer now, right? We used to think that the number one cause of cancer, lung cancer being the number one, was smoking. But we are actually on a path now for obesity to overtake smoking as a number one cause of cancer, right? So that's where we are. So if you're reducing obesity, you're also reducing the complications of obesity, including heart disease, including stroke, including diabetes, and now we know also cancers are included in that category. So it is really, we have the data, we've shown it conclusively that there is a reduction in mortality once you undergo bariatric surgery and life expectancy is extended, but also intuitively we've known it because once we get rid of obesity, we also get rid of those important causes of early death that I just mentioned.
So I was actually just trying to bring something up because as one of these things with us when we are getting ready, some of the things that we are covering these as we do it every day, it's like, to me, it's like, well, there's no other alternatives. It's just, this is what needs to happen and how it needs to happen. And so if I can bring this up, the problem of how many people we have heard in the last 4 months in their 50s, they just dropped dead, right? And there are a couple of people that I know from the family, extended family, some people we know in public, and some people in this community here. And the immediate question that I ask is, where do they have morbid obesity? And well, we already know, like there was just recently, I'm just trying to see if I have a picture of him. That he was a singer and he just, at the stage, he died. Yeah. And he was morbid obese. So with the stress and everything that this, this life can give us, dealing with that without morbid obesity is one thing, but then with morbid obesity, we are not buying our risk. So, and there just recently there's someone else who had the same problem, and then you know that there is a direct correlation with the quality of life, but also life expectancy. Now, would this be a fair question if I were to ask you, Dr. Irgau, someone who is, dying from morbid obesity, who has hypertension and other issues, if the same person, they may still have other comorbidities, but if they didn't have morbid obesity, chance of them overcoming that attack, like this, if it's a heart attack or whatever that happened to them, if we can compare those two,
absolutely,
what are the chances of the other person living in that case?
No question, no question. So the person that is suffering from morbid obesity has huge disadvantages, not only in terms of having those illnesses that we talked about, but also in terms of their ability to overcome medical problems. I mean, one of the ones that we've talked about, and it was interesting that I saw it in my list, is COVID, for instance, right? Come on. Mm-hmm. COVID the mortality was disproportionately higher in people who were suffering from
Exactly.
morbid obesity. And that tells us one thing, in that our body is so diseased that its own ability to heal and overcome problems is reduced. So certainly, if you have two people who are having a major illness and one person has morbid obesity and the other person doesn't, yes, clearly the person with morbid obesity is likely to have way more complications. Let me give you another simple example. If people are going for a procedure like knee replacement surgery, for instance, or hernia repair, right? Their risk of problems with anesthesia is really related to their weight profile. The person with morbid obesity is clearly going to be classified as somebody much higher risk for potential complications compared to the person who doesn't have that. Both of them could have high blood pressure. Both of them could be struggling with type 2 diabetes, and yet the person with a higher body mass index will have way more disadvantages when it comes to overcoming complications of that surgery. So I think that is a reasonable question, the one that you presented, and it tells us how much of a burden obesity is for a person's health. And that's why it's so critical to address it when you look at a person's overall health profile. So no longer can we just accept the fact that somebody goes to their primary care doctor, sit in front of their doctor for their annual physical, and ignore completely the weight of that person if that person is suffering from morbid obesity. That has to be addressed. And there were hang-ups in the past because we ourselves as healthcare providers were reluctant to address this issue for many years. And it was very common for patients to go year after year to their doctor and their body mass index continuing to increase, and no discussion would be undertaken about the weight of the person, right? But that is changing, thank God. We are seeing that there is really a much bigger awareness, not only, of course, among the health care providers, but also among patients, that now weight is not an issue of appearance. It's not an issue of inconvenience. It's a health problem. It's a medical problem. It's a disease, and that is how it has to be tackled, essentially.
And I find one of the videos, so if I can just bring it up. So clearly, the guy was struggling, but then, with these drugs and alcohol and other stuff, they're always part of their problem. In terms of different bariatric surgery types, would that have any impact on the life expectancy?
So that's an important point, Kemal. And I do want to add to that one other thing you mentioned earlier on, the patient's perspective, right? So if the patient is a younger patient compared to somebody who may be, for instance, on the older side, right? Patient who's, let's say, 65 years old compared to a patient who's 30 years old, a patient who's undergoing a sleeve gastrectomy compared to a person who is undergoing gastric bypass. Would that make a difference? And it is legitimate for us to look into this. And clearly what we're looking at is what is the risk of the surgery itself, right? That has to be taken into consideration when we're looking at life expectancy. Well, surgery, of course, any type of surgery, particularly surgery that requires general anesthesia, does carry a risk, right? But for bariatric surgery, that risk, the risk of 30-day mortality, has been reduced considerably. Now, if you look at gastric bypass and gastric sleeve, there is a very small but clear difference, that there is a higher risk with gastric bypass compared with sleeve gastrectomy. Clearly, these are two different procedures in terms of how they are performed. There is more complexity with gastric bypass. And also, even when you look at living with gastric bypass as opposed to living with the gastric sleeve, the implications of gastric bypass lead to a situation where you could potentially have more problems in the future. And we talked about this in our sessions when we were looking at the difference between the two procedures, right? The major difference between gastric sleeve and gastric bypass is that with gastric bypass, there is rerouting of the intestine. And there is a new connection that is made between the intestine and the stomach in the case of the gastric bypass. That by itself does carry implications long term. Now, does that increase the risk of death, after the first year, after the first few years? It is possible because there are specific complications related to gastric bypass that you don't see with the gastric sleeve. One of them, for instance, is bowel blockage. Bowel blockage can occur with gastric bypass way more readily than with the gastric sleeve. And if the person is not getting medical care very, very quickly, potentially serious or life-threatening complications and situations can occur in the gastric bypass situation, right? So there are clearly differences between the procedures, but by and large, when you look at bariatric surgery and its safety profile nowadays, we can say that the safety profile of these procedures by and large is comparable to very safe procedures that we perform all the time, like gallbladder surgery, as I said, or knee replacement surgery, which is a procedure that we perform on our seniors very, very routinely, right? The other thing that you have to consider, of course, is this: every individual is different, right? And that is why you and I, in these sessions, we are talking about broad issues. We're never really looking and advising a particular patient about what they should be doing. We always specify that each patient is unique and their medical care is best served when they have a one-to-one consultation with a bariatric surgeon. Clearly, the bariatric surgeon will be looking at many factors before advising the patient at what procedure may be best for them and what is the procedure that will likely result in less problems, in much better improvement of the complications of obesity, and therefore a longer and better quality of life as well. These are important issues, right? So, for instance, clearly, I made a big contrast before between a person who may be 30 years old and a person who may be, let's say, 68 years old. Both of them could be suffering from morbid obesity, but clearly the complications of obesity will have gotten much more chronic in the person who is older, right? And the resilience also in terms of the body healing, in terms of the body withstanding potential complication of the surgery are better in the person who is young compared to the person who is older, essentially. But even with those factors, we can really assert, Kemal, that the studies that we have seen, which included patients of different age, obviously female and male, have shown that if you have a person with morbid obesity, the chances for them living longer are much better if they have bariatric surgery with the resolution of morbid obesity and the complications of obesity, including major causes of mortality in our country, including cardiovascular disease, cancer, and metabolic problems like type 2 diabetes.
So, Dr. Irgau, one of the other problems that we still see is how the medical community actually is treating morbid obesity. So, knowing this, can we actually, do you see a way of patient-centric care for bariatric treatment, and how that would impact the long-term success of the quality of life, and maybe being in United Medical ACO, that also gives us certain advantages, us being very clinically integrated with our bariatric program. But overall, if you can kind of talk about that.
Absolutely. Actually, I've been very privileged to be part of the United Medical ACO and participate, at the board level and also at the ACO level. And one of the things that is really clearly putting United Medical ACO really ahead of many other organizations is its outlook in terms of what really matters to benefit a population from a health point of view. And I can see, for instance, that United Medical ACO has placed obesity pretty much at the center of the things that need to be addressed within its population. So it is something that is discussed all the time among providers, right? For instance, the simple insistence, for instance, of the nursing leaders within the ACO about the importance of recording a patient's body mass index, right? As important as other vital signs, right? It tells us how important we believe the weight issue is impacting the population, right? And we're talking about a population that is within a society where the obesity rate has reached 40% right now, which means that no matter where you go, in the United States, you will have about 40% of the people living with obesity. So our United Medical ACO population are not exempt from that. They will have a very high rate of obesity as well. And if we don't pay attention to obesity and care for it, then we are not going to be successful in terms of improving the healthcare of all our patients. So yes, this involvement of the primary care doctors, the care coordinators, the specialists, the endocrinologists is speaking a lot about how the ACO is looking at obesity as a very important factor that needs to be addressed, tackled, and treated for us to improve the health of our patient population.
So, thank you for that. Just kind of, we do have a little horse in the race. As I'm being the chairman of United Medical ACO, you are being the co-chair of it, but you are the president of our bariatric program. So, and I know that we are not in the same situation where most of the other programs are. So we are blessed from that point. And there are 6 focus points for United Medical ACO, and obesity is in the same group with diabetes, hypertension, CKD, the chronic kidney disease, psychology, psychiatry, and the pulmonary sleep issues. So all these things are actually kind of like, if you look at the certain process that patient needs to go through, many of them, they need to hit those points to get clearances. Sleep apnea being one of the main issues for those, and in some cases, maybe diagnosing sleep apnea may not be the most convenient for the patient because they have to do either home sleep study or some other ways, but they can also use their Apple Watch. There's a sleep apnea module, so then they can keep their phone and it will tell them if they are going to actually go through any attacks during the sleep, just like the way that we keep record of track of activities and other things. Heart rate is another one. But what I would like to do is just share this. I'm going to share my screen for a second, and I mean, I just find this image of it. So this is a guy who's passed recently. Now it's going to be screen. It's going to take the whole screen. So let me make sure it shows up nicely on the YouTube. So he's 53 or 54 years old singer. And if we don't focus on the pictures, so this is kind of like our focus. We see a morbidly obese, unhealthy individual. Now, when he loses his life on stage, very young, the first thing that the first thing, immediate thing that it comes to my mind is, okay, this is morbid obesity. There may be other things, drugs and other issues, but this much weight on this individual, and this is not his frame. So we know him for so many years. He used to be skinny. He used to be not so skinny. And now, before he died, he was going through a lot of probably difficulties because of the challenges of morbid obesity itself, difficulties on mobility and everything else that it's going to make it difficult. This individual, it doesn't surprise us when I see the person who's just drug dead with morbid obesity. So I'm going to take the picture off. So what was your first thing that you saw on that picture?
Yeah. I mean, what you said was clearly it, right? I mean, one thing about in terms of the morbid obesity, it's not something that you can hide. Essentially, it's not something that you can have HIPAA protecting. I mean, it is. You can see it clearly, essentially, and now we know better than ever that it's not a question of appearance. It's not a question of inconvenience. It is hiding major medical problems associated with it, and heart disease is at the center of it. Heart disease stroke, high blood pressure, diabetes. All these problems are really related to the ravages that obesity can do to our body. And unfortunately, those are also causes of major mortality and early death in our society, essentially. So when we're saying that, bariatric surgery is an effective treatment for morbid obesity, we're also saying that not only it's reducing or eliminating those illnesses like diabetes, high blood pressure, stroke, and heart disease, but we are saying also it's preventing early death, right? So the question, obviously, that is inescapable is, had a person who passes away prematurely and they were struggling with morbid obesity, had that person have their obesity addressed, would their trajectory would have been different? And with the data that we have, you have to wonder about that question. You really have to.
So I'm gonna share one more picture. The only reason I'm gonna share this one is the host of this program. You're about to see. Let me actually speak over that one. I'm gonna bring it up.
Yeah.
Again, the focus is from our specialty. We look at things maybe a little bit different than others. So here is another individual. Now, this guy is friends with that other guy who just passed. Now, the only reason I saw this one is because the host actually is a very famous guy, this one. So, and he's also morbidly obese. But this guy, who's friends with that other guy that I just showed you earlier, I was concerned about the diet. So he's, it's really, like you look at the picture, I'm going to stop sharing it, so then I'll tell you what I'm going to tell you. So this is our picture, right? So if this guy commits suicide in the next 4 to 6 months, I would not be shocked. So it's a huge problem that he has depression. He's a singer, and he's one of the he's an opera singer, so he can hit the notes no one else in the world can apparently do, and there's only a few people with his level, and yet I see a very depressed individual which doesn't have much motivation in life, and I'm like, it's related to morbid obesity. So this is going to impact this. He's only 40 years old. So what was your first reaction on this?
Yeah, similar as well. I mean, right? I think, again, weight is an issue that is there. It's present, right? And as a healthcare professional, that's what you see is we say, okay, those could be potential medical problems that then individual could have. And we've talked about mental health and obesity as well in the past, and we've seen that, for instance, depression is way more prevalent among morbidly obese patients than it is in the normal population. And that also has to do with the fact that the quality of life is not so good. And with that, emotional eating, stress eating can occur, which can lead to a vicious cycle whereby, you are emotionally feeling really low, and you want to get rid of that and maybe reaching to foods that could be comfort foods, and they are the kind of foods that really cause weight gain as well. And you can see that self-perpetuating cycle that can make things worse as the time passes.
So I have one more challenge. These are all not staged, so I'm just that's why I was a little bit busy with looking for some stuff. Here's another picture. He's Robert Kennedy Jr. I think he's 73 years old. You may like him, you may not like him as an individual. It doesn't matter. I hope it does. This guy is doing push-ups. He's fit. I hope he's not doing any drugs. but this is how he lives his life. So, except the way he sounds, everything else looks healthy. You heard him talking, right?
Yeah.
So
yeah, absolutely.
I mean, look at the guy. So like he's at that age, he's able to do it. Now, this may be a little bit on the extreme side. Maybe you don't need to do this, but this is the other part of it.
Sure. But obviously, as we said in other sessions also, Kamal, that there is a spectrum of biology also, which may be more visible and more applicable to certain individuals than others. In other words, you could see, for instance, people who may not necessarily have a struggle with obesity based on their biology. And of course, and then if they add good lifestyle, then their results are going to be excellent. On the other hand, you could see people who really work very hard, in terms of reducing their eating habits and also try to work out, and yet the results are very, very poor. And we see that, and that biological tendency tends to be much more present among the people who suffer from morbid obesity, suggesting that it's not just a question of willpower. There is also issues related with your own, with your biology, which is something that you get from your parents, essentially. So yes, absolutely, I get it. I think people who are going to be more focused are more likely to be able to escape the ravages of obesity, but not everybody, because we know also that the key driver of obesity is not just necessarily the lifestyle, but also the genetic makeup of the.
Absolutely.
Yeah.
Now we can talk 24/7 on this topic. So we did cover this in other sessions so many times, so they are going to be in the playlist for their own topic-specific playlist. So if you want to find out more about these, please feel free to watch those. And again, this is one of the key issues that we see time to time, and it's not going to go anywhere unless we make drastic changes. And it's not just a change, but being able to register certain things. So what do I mean by register is like comprehend and understand and commit. So yes, I'm going to do this. Yes, this is a problem, or put more effort to understand the problem. And once that's in place, life will be a lot more enjoyable. Well, nothing comes for free. There's always consequences. We have to put our commitment into our body and for well-being and for better life with our loved ones and families, and doing better every day with quality of life. And hopefully this session was helpful for those who are looking for different solutions for their fight in morbid obesity. Dr. Irgau, thank you so much again for joining us.
Thank you.
So we'll be back next week with another topic. Holidays are coming. We may do one session with the holidays, but we'll see. It's not decided yet, but we'll be back next week. Thank you so much again.
Thank you. Bye-bye.
Bye.